This study is noteworthy because there was a large sample size, so a lot of women were studied. There was a good long sampling frame from 2006 to 2014, and within that realm, these were all women who were under 40 years old when they were diagnosed with breast cancer. Unequivocally, these individuals meet the National Comprehensive Cancer Center guidelines for recommending BRCA testing as part of a standard of care for those individuals. So to see an uptake of 86% of BRCA testing is very encouraging. It suggests we're getting close to what we should be doing and the potential for those women. The reach has gotten to 86%, and that we can reliably offer cancer risk counseling and testing in the context of women being diagnosed with breast cancer. In other words, that they can reliably get genetic cancer risk assessment integrated into their cancer treatment plan, as well as a prevention plan for post-treatment care. It was predominantly a higher socioeconomic status and mostly white. And so what's not there is a high representation of people of color or people who are sociographically and demographically disadvantaged. And so we want to see access to care for them as well. So, and part of my comments on this study were that I don't want to wait another 20 years for that to happen. The fact that there was a number of people who said they weren't getting tested because their doctor didn't think they were likely to have a BRCA mutation or would benefit from that, or the patient didn't believe so, really flies in the face of what we know from the National Comprehensive Cancer Center guidelines, which is any woman under age 40 with breast cancer warrants cancer risk counseling and genetic testing as a part of their care. One of the concerns I have, of course, that we need to understand better is, in this study, most of the women who were found to have a BRCA mutation chose a bilateral mastectomy. The worrisome part is that 50% of the women who are BRCA negative still chose to have a bilateral mastectomy. For the most part, most of those women wouldn't have had extraordinary risk for a second breast cancer. Now, this has been a trend across many studies and at a population level with increasing uptake of bilateral mastectomy, all in the face of not having evidence for an improvement in mortality for those individuals choosing that. And I believe we need more research to look at what are the psychological scenarios in which, and what kind of support do these women need to make decisions insulated somewhat from the fear that is almost certain to be there for a woman who's just been diagnosed with a breast cancer.